metaphor. To take our conversation in a slightly different direction in this of today's challenge of exploring the issues of technology, I'd like to introduce you to our next speaker. This is Karen Knight. Karen is the General Manager of Advocacy and Engagement from Vision Australia, and I think Karen's going to offer quite an intriguingly personal perspective on this broader, somewhat more anonymous issue of technology in health. Karen.
Good morning, everyone, and thanks for the opportunity for being here today. I'd like to acknowledge the traditional owners of the land on which we meet today, the Yugara people and the Turrbal people, and acknowledge the elders past, present, and those emerging. So today, I want to really talk to you in a bit of a different way. This is the third day of a conference where you've been madly note-taking, looking at screens and studying all the material that you've been listening and watching. But this session's going to be a little bit different because the presentation of information in a predominantly visual way makes no sense to me. So today it'll be about listening. And I'd like you to take the opportunity to immerse yourself in that experience, albeit superficially, into the consumer experience of someone who is blind or has low vision. And it might feel a little bit uncomfortable, and you might be likely to be seeking some visual stimulation from other parts of the room. But I challenge you to engage with that experience of listening and hearing as your primary sense of connecting with what I'm saying. So many of the concepts that I'm going to be talking about are equally applicable to many disability groups, even though I am going to be focusing on blindness and low vision. I will first talk about some of the facts around blindness and low vision, and I want to talk about access as a key construct for hospitals and health services to focus on. And I want to talk about access not only in environmental terms, but access to information and throughout the interaction with the healthcare system. And some of the key elements that ensure good patient interaction. And technology is certainly changing what that looks like for us, but it doesn't replace simple, good customer service. Training is also a really important part of having a good healthcare experience that's accessible for people with disabilities. So, solid foundational skills in providing appropriate support to people with disabilities, and in fact the whole population, is essential. For example, that people in healthcare settings know how to greet and guide someone that's blind or low vision. So a lot of the messages are appropriate to healthcare executives, managers, allied health staff, operational staff. All right, so let's look at some of the facts of blindness. In developed countries, blindness affects about 1% of the population. So it is a small incidence disability. But the research has shown that apart from cancer, losing sight is really what people fear the most. In developing countries, however, the rates of vision loss are far higher. So in these countries, uncorrected refractive error and unoperated cataracts are leading causes of vision impairment. So in the world, there are 285 million people who are blind or vision impaired, and 90% of those are in developing countries. 39 million people are blind and 246 have mild to moderate vision loss. It wouldn't surprise you to know that 2/3 of all people who are blind or low vision are over 65 years of age. And in Australia, there are 5 key conditions that contribute to about 75% of vision loss. And they are age-related macular degeneration, cataracts, glaucoma, retinitis pigmentosa, and diabetic retinopathy. People who are blind or low vision are 3 times more likely to experience depression. So this is due to the impact that sight loss has on independence, on your sense of mastery of simple and complex activities of daily life, and the ability to build and maintain and participate in social networks. People who are vision impaired are 4.4 times more likely to be out of work, and in developing countries this figure's a lot higher. So much of one's ability to participate economically depends upon community attitudes towards disability. And we know the links about economic participation and the link to well-being. Those with sight loss are also twice as likely to move into residential care prematurely. Unless they have the right rehabilitation inputs, then there's much greater likelihood of falls. Very few blind people see nothing at all. Very few see total darkness. Most people have some varying degree of being able to see shape or colour, or have a restricted field or a loss of central vision. So it's always really important to not assume that people can see nothing. So in an environment, using concepts such as bigger, bolder and brighter can really assist people in those environments. But information is such an important part of the world we live in, and healthcare is no exception to that. But only 5% of all the world's information is available in alternate formats. And when we're talking alternate formats, we're talking braille, audio, and accessible electronic format. So in healthcare today, an increasing amount of emphasis is really being placed on the importance of people being informed consumers of services. But that concept of informed consumption relies on the free and open access to relevant information. And that's not routinely available to people who are blind or low vision. So you see this in a variety of contexts. So much of the information is an ephemeral kind relating to health issues. You see it disseminated through bulletins, brochures, etc. And the existence of this information and its contents remains unknown to many people. You think of walking into a healthcare setting, you see many brochures around the walls and posters up. If you're blind, you don't see any of that. It's not there. So only a small fraction of any of that information is ever even made available in alternate formats, accessible to people with print disabilities. Even reference materials are seldom available in alternate formats for purchase or for library collections. So a person who's blind, they might be, wanting to learn about caring for their children or pregnancy, or they might be diagnosed with a life-threatening illness, but they have access to a severely limited range of information, and usually very difficult to increase that access. So healthcare institutions do generate a lot of information, whether it's around inpatients, outpatients, whether it's just community information and preventative healthcare programs, but usually that's not made accessible to people with disabilities, print disabilities. So poor access to this information impacts on health and well-being for people who are blind or low vision. The same applies to pharmaceuticals. You are starting to see some braille on some pharmaceutical packaging now, but then people who are blind or low vision who can actually use braille is a very small percentage of the population of blind people. So packaging of most proprietary pharmaceuticals is generally labelled in a manner that is completely inaccessible unless you've got good visual acuity. So it's also the equipment for measuring and monitoring is either inaccessible or prohibitively expensive. So it's very difficult to find medical measuring devices with tactile markings. So talking glucometers exist, but often they're out of financial reach of many people. There's talking thermometers, there's talking blood pressure monitors. So some of these things exist, but whether they're accessible to people is another story. So there are serious issues that we need to consider when even the minor variation in dosage can have a significant implication. So when interacting with the healthcare system, people who are blind are as likely to be interacting with the system in the role of a patient or as a carer or as a visitor. So access to information is the single largest barrier for people who are blind or low vision. Consider the hospital or the facility. How is it communicating to people? Mostly using print information. And while there is some technology available to help people who are blind read print, then it's by no means universally available. And depending upon the circumstances leading the person into that healthcare setting, it mightn't be available to them. For example, one of the greatest technology advances has been the iPhone and the universal design of an iPhone. And I can use any iPhone, turn it on and it will speak to me if I set the settings right. And so there's many apps that will now help me read print in a way that I couldn't do before. But again, you've got to have access to that technology. So while it's helpful to have information in electronic formats in websites, it needs to meet web accessibility requirements. And there's also a difference between what's accessible and what's usable for a person. So you might consider ways in which you have information available in your facility. Audio format can help, and this can help not only people who are blind, but people who might have literacy issues. For example, relying on staff in a hospital to read information, and that's what usually happens, or sometimes they won't read it to you because they think that you need a substitute decision maker because you won't be able to read it for yourself. But when they do read information, it is a poor substitute for a version of that information in a format that can be independently accessed. It eliminates, if you can independently access something, it eliminates the human error and allows you to access that information in a way, in your own way and in your own time. So information is so much part of interacting with the system, with the healthcare system. Think about signage. That's another way of providing information. Wayfinding technology is becoming more and more affordable for organisations, and the provision of information accessible by other senses is helpful to the whole population. Other information that is exchanged during the day-to-day happenings in a hospital, how does one fill out a menu? How do you understand using the various buttons on remotes, etc. All of this can be explained, but it's very likely that you're not going to take that in first time. And as most people who are blind or have low vision are older, they have varying levels of acceptance of their vision loss, and therefore they're often in a position of feeling that their personal power is compromised, and they're not really very likely to ask for help. Also, often people are in circumstances that might be quite distressing when they're in interacting with the health system. So making that access as easy as possible is critical. Normally, your normal compensatory skills may not be working as well as they otherwise might. If you can help someone prepare in advance, it's important, and that's where something like an audio description of the layout of the hospital would be useful. You can produce tactile maps as well. Now again, people have different abilities to understand that information, but if you could access an audio recording of how to move from one place of a hospital to another, would be useful. Also, it might just be about how and when volunteers might be available to assist. So again, there's a whole lot of ways that information that other people take for granted can be accessed. We can also think about the environments in which we operate in. So in many countries, there are standards for accessibility that are part of a building code, the building code. And this means that for new buildings or substantial refurbishments, these standards apply. And with respect to Australian standards, you will see some of those building standards in this building here. So you probably might have noticed walking around here that you feel some bumps under your feet at the top and bottom of stairs or ramps or escalators. They're tactile ground surface indicators, and that tells someone who is blind or low vision, hang on, watch out, there's something going to change. So it's a warning, and a really useful warning. Also, you will have seen on things like a braille on outside the toilets. Again, another useful building code necessity that helps people operate around these kinds of environments. Again, it's a standard that builders need to comply with that does facilitate greater access. There are other ways that you can enhance your environmental access too. So having tactile and bold print numerals next to doors is really helpful. It can also be good to have these numbers in braille. So while Australian standards don't require these in braille, regulations in other countries such as the guidelines under the Americans with Disabilities Act do prescribe the use of braille numbers. These sorts of initiatives aid independent navigation around a facility. So any ways that you can think about using concepts such as bigger, bolder and brighter will assist. So when a chair is, a different colour chair is placed on a contrasting colour carpet, then it's much easier to find. If plates are on a tray and they're contrasting colours, then they'll be easier to locate. So it's best if glasses have a pattern on the outside of them. Otherwise, people with some residual vision are likely to knock them over because they're plain glass, they can't see them. And again, that's why there's often contrasting strips on glass doors. So the use of different surfaces, including different colours and floor textures, can aid navigation. It's also important to have a structure to the physical environment because wide open spaces without clear edges to navigate can greatly increase the likelihood of confusion and disorientation. So maybe there's some ways that you think that environmental access can be improved in your facilities. Above all though, the training is key. So there's often a high level of turnover of staff in hospitals, so meeting the challenge of providing efficient and cost-effective training is ongoing. But implementing a culture of strong customer service will help deliver that best practice support to people with disabilities. So I just will go through a few really some specific tips about how you can reinforce good support for people with disabilities and people specifically with vision impairment. A lot of it is really good common sense. And, you know, empathy is the key. Putting yourself in the place of someone else and thinking how you might like to be helped can really facilitate brainstorming some useful ways. So it's important to introduce yourself to the person and address them by name. I can't tell you how many times I've spoken when I thought that someone has been talking to me and they're actually not talking to me at all. When you come into a room, address someone by name, introduce them to the other people in the room if they haven't been before. Ask the person what they're able to see. They won't mind telling you. And what assistance they need. Don't assume what they need. The patient, and ensure that the patient is included in the discussions and procedures. Often, being blind, people think you might have a hearing impairment as well and yell at you. When you're leaving, indicate that you're leaving, because the person's likely to continue to talk to you when you're gone. When a patient's in bed, put a patient identifier sign above the bed, so that other people who are coming in and out of the room will realise. And consider, for some people, adjustable lighting is going to be really helpful. Also, talk to people about how you can mark their medications bottles for them. It might be a tactile marking that you agree with them. It might be some larger print. Whatever is going to work for that person to be able to tell one thing from another. Sometimes even putting someone in a hospital bed that's in the corner, so they've got something to help them locate. It avoids confusion with another patient's equipment, and it helps them arrange their belongings more easily. And don't unnecessarily move things. If items are moved, let them know that something's moved. There's nothing more annoying than thinking something's in a certain place and it's not. Always inform patients before undertaking any procedure. Many people do that, I know, but it can be very unnerving if the patient's touched without warning. Also, helping to provide structure to the day, and knowing the time can be part of that. So you probably wouldn't be able to see a clock on a wall or anything, but ensuring that the patient has access to a radio, maybe it's a talking clock, maybe it's a talking watch or a braille watch, something that helps them have some orientation about the time of day. When people are up and about, it's important to orient them to their surroundings. And to do that, start from a central location. Start from their bed, for example, and walk with them. Don't just say, oh, if you walk 5 steps over there, you'll come to the bathroom, and if you go this way, you need to do it with them. Walk through several times, and then you'll find that the person will, depending upon their circumstances, but most often they'll be able to do it themselves fairly quickly, because they'll pick up other sensory cues and be able to gauge distances. So, for example, to get up here today, I practiced that a couple of times this morning. And it might sound really strange to you, but when I can walk onto the stage, I can hear this lectern because there's something in the space that I can hear. It's important to keep pathways and corridors clear of obstacles wherever possible. And ask the person who's blind if they want to grab your arm. So if to guide someone who's blind, let them hang on to your elbow, and so that their thumb is in the crook of your elbow. But they will walk half a step behind you, and that half a step behind you is critical, because your elbow gives lots of information. So if you're walking along and there's a step down, your elbow goes down, so that would give me the indication that I need to step down. Similarly, similar things apply with children as well. And, you know, in the context of children, often parents can give a number of cues. With babies, often blind babies lie very still on their back, and people mistake that for having other problems. What it's about is they're listening to their environment, but it's important to keep them stimulated, and doing that by touching, talking, providing them things to play with that have varying textures and that are in easy reach, and that, you know, that are safe and make interesting noises and are pleasant to feel. Similarly, for young children, enabling them to move around their environment, explore their environment, and become comfortable with their surroundings. Using a hands-on approach to introduce new objects to children is also important. So, when mealtimes is often a time in hospitals, for example, where many people who are blind or low vision report the most difficulty. For example, even being able to choose what they want to eat because they can't read the menu and someone's just put it there and you don't even know it's there. Telling people that something's been put in front of you, and that using colour contrast can be really helpful to orient things on a tray. So when you're describing the contents of what's, using a clock face is critical. So you might say, you know, your drinks at 1 o'clock, on your plate, your steaks at 6 o'clock, whatever it might be. But using the clock face is a universal way of describing where things are. And ask people if they want assistance. Don't assume that you need to provide the assistance. So I want to just suggest a couple of recommendations that might help you think about your health facility. Many hospitals and health facilities have disability action plans, but often they're not implemented. And so thinking about ways that you can truly implement a disability action plan can be really important. An increase in resources certainly is always what, you know, is usually, resources are usually a barrier to implement much around disability action plans. But if accompanied, but really it is about changing priorities. I'd also recommend that you get to know the local disability service providers in your community and the consumer groups that can really help provide advice. These partnerships can be really powerful. And they really can support the inclusion of people with disabilities in healthcare settings. And that inclusion is an invaluable resource in the development of your disability action plan and other continuous improvement initiatives. There's also clearly a need for work to be done in relation to training in institutions and professional bodies responsible for education, certification and professional development of medical and paramedical personnel. The broader health system should leverage connections with these bodies to influence appropriate training of health staff to improve their competence in appropriately supporting patients with disabilities. We need to critically analyse the environment and the information access in your facility as it relates to people with disabilities in general and specifically in the context that I'm talking, vision impairment. But I urge you to incorporate access improvements into your quality improvement processes. Thank you.